Hello. Okay, perfect. Hi, everyone. Good morning. Really excited. Thank you so much for that, Kate. I'd like to maybe just ask our esteemed speakers today if you can join me on stage and we can have the introduction while you're on here. All right. Well, I'm really excited to kick this off because I think for the past week or so, and even as of yesterday, I've just been at the Palais, kind of trying to figure out what's happening with the pandemic agreement. So today with us is Dr. Roland Driece, Director for International Affairs, Ministry of Health and Welfare and Sport, but also the co-chair of the INB, who's really done hard work, very late nights in a lot of times to get us an agreement. And then we have Dr. Fifa Rahman, principal consultant at Matahari Global Solutions, and of course, she's been providing technical advice to the Africa Group on the negotiations. And of course, we have Dr. Magda Robalo, president and co-founder of the Institute for Global Health and Development. Thank you so much to our panelists for, coming here very early this morning to discuss this. Dr. Driece, I just want to start. I think it's on everybody's mind. What's the next steps for the pandemic agreement after you've not reached consensus last Friday? Can you try again? Yep.
Oh, now it is. Good morning, everybody. It's good to see you at this early hour of the day. What are the next steps? Well, basically, they're not in my hands, to be honest. We were, as a collectivity, as the IMB, we were supposed to deliver an agreement. But actually, we were supposed to deliver an outcome. That was the only mandate we've been given. Report on the outcome of your work. And of course, everybody had hoped that that outcome would be something complete that we could all agree upon. But as you all know, that's not the case. So the World Health Assembly today actually needs to decide what is next. And well, the options are rather straightforward. You can either continue with the aim of finishing it, or you could stop it. And that's all the flavors we have. And I presume from what I've heard from everybody, and if you also look at the concept resolutions that are circulating, is that most member states are opting for a continuation. And then the discussion will be for how long and in which format. Is it in the same format as we're having today, or do you want to change that a little bit around? Because changing the scenery is sometimes useful to get the energy back in or get the process going again where it's stuck now. And for how long? Half a year, 2 years? Those are the terms that you hear circulating. So I just look very much forward to that discussion and see what they decide.
I just want to build on that because as this morning, two draft resolutions are published on the WHA website. There's one from the Africa Group, and maybe FIFA, you can maybe talk a little bit about that. But then there's another one, really, from some high-income countries, and one of the proposals is to have a special session, hopefully before the end of 2024. So maybe can you talk about that? Like, what are some? Is it likely that we're going to have a special session, or will there be text-based negotiations happening this week alongside WHA?
Well, I don't think it will be wise to have text-based negotiations this week because, in my view, we're not going to finish those. The chances of finishing the discussions during the WHA are, in my view, zero. So why should you try to do that? Why do you push people who have been working very, very hard over the last 2 years into such a regime? That will not be my suggestion anyway. I mean, if member states say we're going to do it anyway, well, I can't stop them, but it would not be my advice. And then the idea of a special session, I think it's wise to take enough time to tackle those really sticky issues that are still out there. Because if you look at the quantity of issues, we've solved a lot. But if you look at the quality of the issues still on the table, they're not easy. They're about IP. They are about percentages that industry should be setting aside for delivery to countries most in need. They are on sanctions, for example. So there are really politically sensitive and difficult issues. And if you want to tackle those, you just need to take the time to really sit down with countries and see where there's room to maneuver and go to other countries and test those ideas. And if you just want to push them in another 3 months, it's going to be difficult to solve them, I think.
Dr. Fifa Rahman, because you're as a consultant for the Africa CDC, you've been providing technical advice to the Africa group on the pandemic agreement negotiations. But before I move to my main question, I do want to ask you if you can comment on the resolution that's been supported by the Africa group. If you can give some insights on that.
So it's going to be tough to provide insights on that without betraying positions. But I can say that I actually agree with Roland that perhaps the special session will be optimal, because you're ensuring there's time to clean house, a little bit of time to have the conversations behind the scenes that need to happen. I think that the UK's non-movement on PABs because of political constraints back home is something to consider, as in as regard the timing of the special session. The elections in the UK are July 4th, and while there's no guarantee that the positions will change after July 4th, I certainly don't see value in continuing right now while emotions are still high and while there's unlikely to be a political shift on the key issues that matter.
Maybe you can give us instead a behind the scenes look at what it's been like to provide technical advice. How challenging has it been to provide technical guidance, including negotiation strategies and textual proposals, to a group representing 55 countries that don't always see eye to eye?
Thanks for that question. So there's no way that we can expect a continent as diverse as Africa to agree at all times. So that's certainly not the expectation. My role has been to provide textual advice, advice on the legal effect of certain words and certain terminologies, as well as comparisons with other treaties. And identifiers on pathogen access and benefit sharing is one of those areas where the ABS system in the BBNJ, for example, the High Seas Treaty, it has identifiers, and we make a comparison there and try to understand why identifiers worked in one and why the Global North are claiming that identifiers might not work in another. But advice is also tactical. So the political economist J.P. Singh, he said that global South countries or developing countries can win through a combination of knowledge, cunning, and daring. And this can happen through a number of ways, right? There's coalition building, for example, where you ensure your coalitions are strong and you negotiate as a bloc. There's also stating that you're bound by precedent at the local level. And One Health is a good example of this, where you examine what Africa is committed to at the national level or regional level on One Health and see how much further you can go at the global level. And coalition building is particularly important, not just within Africa, but within the global South. And India and Indonesia supporting identifiers on PABs is an important one. And when we think about cohesion and strategically negotiating as a global South bloc, that's something that needs to be prioritized in terms of presenting a united front, not just on an African front, but a global South front. And it's also about knowing your opponent and not conceding too early. Now, these are opponents that spoke very highly of solidarity, but we need to remember that there were situations where close to expiry vaccines were transmitted to the global south, right? There's a lot going on Gaza, where we see rhetoric on one thing and practice happening in another way. So we need to ensure that there's protection that way, but strategically, tactically, all of these things matter. So the advice isn't just textual, but also tactical.
I just want to follow up on that because you used the term opponent, and I guess looking at the group, it was supposed to build cooperation across different countries. Why do you think did you use the term opponent in this case?
I think because positions are diametrically opposed, and there may be a lot of talk about, oh, we all want the same thing. But where we are at on PABs, for example, where some countries want up to a certain percentage, some don't want a percentage, others want at least. When the numbers on things just don't, the numbers, for example, AstraZeneca produced 3 billion vaccines in 2021. That's just AstraZeneca. And the Telegraph articles that caused such a furor about 20% of British vaccines going to foreigners. 20% of 3 billion, how much is that? I'm not going to do the math right now, but Britain only has 69 million people. Britain does not need 3 billion vaccines, right? So calculations-wise, we need to think about whether these countries really want equity or whether they're we're arguing on diametrically opposed planes.
Sometimes when we discuss the pandemic agreement, especially when I speak to experts, there's it gets very technical. We talk about PABs, and sometimes my editors would say, "Explain what PABs is to me." We talk about One Health, explain this to me. But I think I do want to ask Dr. Robalo, because during the pandemic, it's not just about access to vaccines, diagnostics, and treatments, right? It's really impacted health systems. It's impacted health workers, right? It's impacted communities. There are other dimensions other than access to medical health products, which are, of course, important. But I do want to ask you, how do you see, I know we don't have an agreement yet, but how do you see this impacting health workers, social context on the ground, beyond just access to medical products? What are the key provisions that you see will directly affect frontline responders and local communities?
I think the entire treaty needs to be looked at in a holistic way. Each clause has some impact on the other one. I think let me just move back a little bit. The pandemic was a real test of how much apart the world was when it came to solidarity, equity, caring for each other, and being able to work together in global cooperation to prevent a disaster. So after the COVID, we had a small window of opportunity where everyone commented, and we still comment on how bad it was that we failed to support those who needed support from the global north more than anything else. But then this 2 years journey of negotiating the treaty brought back the realities that we are far apart. The clauses of the treaty in its entirety needs to be based on equity. Each line, each word needs to be crafted in such a way that we protect communities, we protect health workers, and I think no matter how difficult it will continue to be, we have made progress in terms of discussing difficult issues, discussing the need of health workers being protected, having better conditions of work when it comes to outbreaks and pandemics, being supported with training, with protective equipment, IPC, etc., being recognized as the frontliners, and pandemics and outbreaks starts in communities and end in communities, as we say. So they are really the most important agents. And what makes me a bit sad about where we are right now is the fact, for example, that gender or women are words that have been a reason for contention between the sides negotiating. Yet the health sector is majority made up of women. 70%, sometimes 80% of health workers, particularly community health workers, are women. And the treaty, one of the points that countries can't agree on is on how much of women or gender could be included in the treaty. So it is going to be important for us to agree that these service provision, health workers need to be given the conditions of work. My country, for example, one of the major drivers in many other places was the lack of infection prevention and control, which was driven the pandemic. We need to make sure that this doesn't happen again.
I just want to build on that because here we feel like we all have a sense of what the pandemic agreement is, but to what extent are people on the ground, nurses, local community leaders, aware of this and its potential implications for their work?
I don't think we are having bottom-up discussions. I think very little filtered down to those who are the first concerned by the outcomes of this treaty, unfortunately. And we need to make sure that countries, as soon as possible, give feedback, consult the communities, civil society, private sector, the communities in the countries, particularly the global south. They need to be aware, and we need to combat misinformation so that people know exactly what we are talking about, what we are discussing, what are their concerns, what are their needs, and how much governments are fighting to get them protected. There is very little information filtering down, and that's a danger because we have seen how misinformation has been bad for us to combat the pandemic. So we really need to work down to getting people informed and give feedback. This treaty, I must say, is a first step in a long process. I think just as we have seen with the IHR, after a while we had to renegotiate it to tighten some of the clauses, make it clear and make it more usable, more effective for people to be able to implement it. I think if we get a treaty, I agreed we shouldn't lose momentum, no matter how difficult it is. And we know there are issues that probably will not agree upon. And some, even if we do agree, it's not given that countries will enforce. Implement them when if a pandemic hits. So it's yet to be seen. But I think it's better we have at least some common ground and then be better prepared than we were when we started. For us, there is no other compromise. Equity should be on the first line throughout, and that's what we demand. That's what we think the world deserves. We cannot talk about global solidarity, cooperation, if we have close to expiring vaccines being sent for us to just put them on a bin.
Dr. Driece, this been a really long, well, for some not really that long, but it's been 2 years plus process. Could you provide insights into the evolution of the negotiations? Share with us some of the challenges and opportunities you've encountered.
Yes, when we started this was still in the aftermath of the COVID crisis. And then it was pretty obvious for everybody that we should do this. And world leaders came together, they wrote open editorials in the New York Times, I think it was, and everybody agreed that it was one of the most important things in multilateralism we could do. And what you see, and I think it's also understandable in a way, is that with time progressing, that urgency is slipping because there's so much in the world that's going on that requires our attention. So it's really a challenge to keep the urgency at where we want it to be. So that's one of the challenges we see and we face. But if you say in terms of progress, I think we all have to realize we started with nothing. We started with a blank sheet of paper. And if you see where we are now, I think we have all the elements on the table. We have all the elements on the table that you have to address when you want to do better as a world community in addressing pandemics. You could argue if it's not too loose, if there's too many voluntaries or too many as appropriates in there. Well, that is just what it is. But I think all the elements are there, and if countries want to work with them, they can work with them. So I think that's a major step. But a treaty is still a piece of paper. It's not Harry Potter's magical wand that changes around the whole world by adopting it. And it's what Mike Ryan of WHO always says. This is a starting point. This is if we, whenever in a year's time maybe, agree to this, you have a platform or something to relate to as a global community to address pandemics. And if the percentages are not right yet, okay, let's start working on these. And then there's discussions on should prevention be stronger, should One Health be stronger. I understand that when countries are in this arena of the IMB and discussing and trying to make their points and getting their points and take them home and present the results. But in my view, you should look at it. The most important thing is that there is prevention in there, is that One Health in there, and that everybody says there is no discussion that it's important to invest in these things. And maybe not all countries are able to do that at this stage. But we also say in the treaty, well, if you're not able to do this, there's technical provisions, there should be financial provisions in place to help you do that. So what I try to say is that we started with nothing and now we have something on the table. When we agree to it, is really a good foundation to start improving the world, but it will not improve the world the next day. And I think we should, and I think everybody realizes that, but sometimes in the height of it all, sometimes you forget about that.
I know Dr. Robin wants to chime in, but maybe just a follow up, and I'll give this the mic to you. But I just want to build on that because you said, if you look at where you started and where you are at the moment, there are some questions, and maybe you can address this. Why text-based negotiations just started, like, I think last month? There are questions around that. And at the same time, maybe you can talk about transparency. Dr. Robalo was mentioning earlier, I was asking about, how much do people on the ground really know about this? How were conversations regarding transparency conducted with member states? Was there any conversation to, let's increase transparency on what we're really doing here to combat misinformation surrounding this treaty?
Well, those are two different questions. I think one is them in the how do you conduct the negotiations? And it's not that we did not, we spoke with each other for 2 years in all kinds of formats, informally, formally, in big groups, small groups. And some say we should have text-based negotiations. Well, to be honest, I know they're part of the negotiations, but text-based negotiations are not solving the difficult issues, because then you're going to fight over words, over sentences. If you want to have a breakthrough on a percentage that should be included, that's not going to be found by text-based negotiations. That is sitting down with countries and saying, how far are you prepared to go? And maybe that's not what others want to hear, but you have to, out there in that meeting room, people are just going to state what they are told to state, and that's not going to bring the solution. So I'm not so worried about that we start late with text-based negotiations or anything. The other issue is transparency. And we try to be as transparent as possible. All the different iterations of the text we have are all on the WHO website for everybody to see. But we also know there's a lot of mistrust, fear, miscommunication, all those things. And maybe just one example, because people approach me as well and there was a woman in the Netherlands who wrote me an email, and she said, what is this all, and why are you doing this, and this is so bad for the world. I said, but have you ever, because normally we don't react to it, but now I thought, why don't I just react to this lady? And so I wrote her an email back, say, well, very good that you did this, but why? What are you afraid of? Why did you get? What are your sources? Have you ever tried to read actually what it is? And then it turns out, of course, that she never read what was in it. And I said to colleagues also, if one of the things that I've discovered this past 2 years, and that really frightens me a little bit, is the sheer number of websites and so-called online TV shows and that just thrive and live from misinformation, and not just on this, but this is something that I follow more than other subjects. Somebody sent me yesterday a little video of a German show, and it looks like a proper 8 o'clock news broadcasting scene, and it's just people dressed up like me, very, very, well, whatever you want to call this, but but presenting things very seriously, and then saying things that you think, my God, what are they saying? And but a lot of people like this lady, they follow that, and they just do not bother reading what's really going on, and that's really concerning, and that goes much further than the pandemic treaty, but that's just one of the things they use, and that's a little bit something that frightens me when I'm in bed at night. Thank you.
Dr. Robalo, I think do you want to come in earlier?
Yes, I just wanted to comment on the issue of trust and mistrust, and the fact that financing is one of the most contentious issues in these negotiations, and having words like prevention, preparedness, response, implementation, etc., is good, but it is only as good as they could be backed by financing. They may turn out being empty words if the critical issue of who pays for what and when do you pay, after you have satisfied all your needs, what strings are attached to the funding that is being provided, those are critical issues. I think we see all this riding on the back of multipolarized world, and we also need to see how much of all this will end up being regional blocks or cross regions negotiations of bits and pieces of a treaty. And I think transparency will require that we also put all this on the table for us to see where things are coming from and where they're going to go. The old man in my village would like to be able to access healthcare if Ebola or any other outbreak starts. And that's where also we need to make sure that universal health coverage is at the center of this treaty.
We can discuss the whole issue around funding for another hour, maybe. But I do want to open this to maybe 2 questions. And I want to start with Agre Aluso, Director of the Africa region of the Pandemic Action Network. Agre, please.
Thank you. Thank you very much, colleagues. And thanks, panelists, for your very, articulate, open-minded contributions. I think we're all very concerned and we're hopeful. We've been joking with colleagues how we were hoping to be popping champagne bottles, celebrating an agreement, but we're not there yet. But I think encouraged by what Ronald said, that there's no contention about the need to get this over the finish line, however later or sooner it may be. So that's encouraging. But really, one thing that I think humanity hoped for, and I come from Nairobi, Kenya, and everybody knows how this panned out, so I'm not going to belabor explaining how it did, but I remember very vividly when a priest from Italy came back home at the start of the pandemic. And by that time, we did not, it was not like a real threat, so they thought. And this priest went to a village, my village actually, to preside over mass. There was, it's celebratory mood, he'd been away, he came back, and then he tested positive. few days later, and there was panic in the village, some far-off village in Nairobi, in Kenya, northwestern Kenya, of a pathogen that emerged in Wuhan, China, and just showed how interconnected our world is, and the threat somewhere very far off from your reality can be a threat to you in no time.
Do you have a question? I agree.
Yes.
Do you have a question?
I have a question.
Yes,
So my
please.
so my question is, what would it take for humanity to really learn their lessons? Because this was our moment of reckoning, our moment of reflection, to really, everybody is emphatic that we cannot continue doing business as usual, and we really need a reset of our global normative framework. Yet the most important things that we need to drive forward, which is equity, as Dr. Ravelo said, and solidarity-based solutions, not market-driven solutions, because that failed us. What will it take to really draw the line and say we must act in solidarity for humanity and global health security?
Maybe very briefly to the three panelists, if you can start, maybe Dr. Robalo, very briefly.
I think it will take leadership, brave leadership, from at least the part of the world I come from, to stand on principles that are non-negotiable. And like I said, equity is non-negotiable. We don't want to find ourselves back in 2021, and there are critical issues that need to happen. Like I said, communities, not commodities. We need to put communities at the center.
Yeah. Dr. Rahman, very quickly.
Very quickly, is just to agree with Roland on the fact that textual-based negotiations are not going to get us to solidarity. Nothing is negotiated in a silo, and any negotiations nerd knows this. What we need is to have those difficult conversations on what will you give me for this? And that's happened in many other negotiations in the TPP, for example, when New Zealand said there'll be no deal on biologics until there is a deal for dairy. And we need that conversation to happen here.
Dr. Driece, the last word.
Yes, well, there is always the world that you want to see and the world that's out there. And those are not always the same. And the pandemic treaty is not going to change that either. I think that we will be doing better when we have a pandemic treaty. That is, like I said, a foundation for further work. But I hope I'm wrong. But it's not going to change the world tomorrow.
Well, thank you so much to our esteemed panelists, really, for these insights, and perhaps a round of applause, please. Thank you.